All right. Our discussion for today it's all about infection control. So that's actually chapter 19 of module 2. And again, it is part of our topic for PSWs because we need to make sure that we are preventing infection in the workplace. And most especially because we are handling our clients. We are very hands on in handling our clients. So we make sure that we know the proper hygiene or how to avoid the spread of microorganism, and that is part of the infection control. Again, when we talk about infection control, it involves the practices to prevent the spread of infection. Like the main one is the very common hand washing, making sure that when you do hand washing, there is a soap and water, running water that rinse the soap, right? So for older adults as well, people with health challenges and individuals with disabilities, they are the one that has a greater risk for uh, infection, right? So that's why our most commonly clients are the clients with disabilities and older clients because their immune system is a bit weaker. So basically, we need to make sure that we don't spread the microorganisms coming from the other individuals to them, right? So that's why, as just I just mentioned a while ago, that proper hand hygiene remains the foundation of infection prevention. When we say proper hand hygiene, the best one is hand washing. So when we talk about microorganisms, this includes the bacteria, fungi, parasites, viruses, etc. Right? Everything that can cause diseases or infection to an individual or to anyone. So again, if you can remember the chain of infection, we usually use the term pathogen. That means that's the one that causes infection, while when we talk about non-pathogen, usually do not cause infection. Okay, so when we have the microorganisms or what we call the pathogen, there should be a suitable environment that they can grow. So it could be in the warmth, it could be darkness, or it could be moisture, right? For them to really like spread and grow. So just a heads up for everyone. So MROs or MRO is what we call the multi-drug resistant organisms. So these are the organisms, or even these are the organisms that actually is resistant to any antibiotics already, because maybe an individual misused the antibiotics, or it could have been done in complete courses. When we say incomplete courses, ideally antibiotics should be given or should be taken by the patient or by the client minimum of 7 days, depends on the doctor's order, right? That's the minimum, 7 days of antibiotics. If the client stopped the antibiotic for, like, let's say only 3 days, and because he thinks he's already better and there's no symptoms anymore, so he thinks he's okay. So that means there might be a tendency that he will acquire multi-drug resistant organisms. So the bacteria or whatever, the virus or whatnot, that in his body will be resistant to the drug or to the antibiotic that he was taking. So most probably, if he will have that, if the illness or the disease will come back, that antibiotic will not be effective anymore, right? So the client might be needing a more or a stronger antibiotic. Um, so again, so if we do that, or even the client do that, that will actually lead to serious risk in the healthcare setting. It could have been like the client will spread the virus or the pathogen, because it's not fully recovered. It doesn't mean that if the symptom stops, the pathogen is no longer present in your body, right? So there's still that then the what do you call this, the pathogen might still be present. That's why you need to really follow the medication protocol that the doctor has given you or has given the client. So we have infection types. It could be local or systemic. So when we talk about local, simply let's say, for example, if you have a wound on your arm, left arm, and it's starting to get, some pus, foul odor, and smelly, that considered be a local infection, right? But if it's systemic, that means it's already in your blood. It might, the infection might spread already in your system, in your body system. So that's why it is systemic, right? Uh, so we have also the HAI, or what we call the healthcare associated infections. So it usually arises in the care environment or healthcare settings, and then commonly affects, of course, the clients or individuals' urinary tract, respiratory, the gastrointestinal, the integumentary system, or what we call the skin. So those are might be common in the healthcare associated infections. So that's why in the healthcare setting, there's always housekeeping that makes sure everything is cleaned and disinfected. Even us, PSWs, if we are like even us healthcare workers, PSWs, nurses, etc., we need to make sure that after we clean or maybe help the client with their ADLs, anything like that, before and after, we need to make sure that everything is clean, right? So we just use like a disinfectant spray or whatnot, just to make sure that we'll leave the place clean and safe. So when we talk about pandemic, it's very common and it's very fresh in our minds of what happened during COVID. That is considered a pandemic because it actually spread rapidly worldwide, right? That virus or COVID spread worldwide. And of course, the one that's most affected are the elderly clients, vulnerable clients, uh, with clients with the low immune system, right? So that's why uh, they have the higher risk of severe illness. Before the vaccine came out, a lot of people or a lot of elderly clients that we have actually battled uh, of COVID, and unfortunately, a lot of them also passed away. Right, so that's why pandemic is actually it's a worldwide crisis. So this is what we call the chain of infection. So we have six links of the chain of infection. First is what we call the pathogen. So pathogen is like considered bacteria, viruses, fungi, parasites, and other things, right? When we talk about reservoir, it's actually where the pathogen or the infectious agent stays, okay? This is where the place that the infection agent lives and multiplies. And it can be like, let's say, a human or an animal, or it could also be an inanimate object or a surface, depends on the kind of pathogen that we have. And then when we talk about portal of exit, it is the way that the infectious agent leaves the reservoir. This includes through the secretion like a saliva, or a mucus, a blood, or by coughing, or even by sneezing, right? Through the air. And after the portal of exit, we have what we call the mode of transmission. So when we say mode of transmission, this is the way that the infectious agent leaves sorry this is how the infectious agent is spread from the reservoir to the new host, okay, to the new host. So when we say to the new host, this can be direct, like say for example through chat, through touching, or even indirect through contaminated objects or airborne particles, right? And then the portal of entry, this is the way the infectious agent enters the new host. So that's how you spread the infection. So this can occur through inhalation, ingestion, or even breaks in the skin that's open, right? And susceptible host, it is a person or an animal who is at risk of becoming infected. Factors like, of course, the age, like old elderly clients because they have lower immune system, or underlying health conditions that has lower their immune system, and in that sense they can be more susceptible. Okay, and of course that's always the chain, and it goes back again, reserva and everything. So that's what we call the chain of infection. All right, so when we've talked about chain of infection, we talk about the pandemic. So we also have the vaccine, right? The vaccination, which actually solves majority of our issues during the COVID pandemic, right? So vaccine prevents serious illness because it protects our immune system and also fights the pathogen, right? So that's why you guys, when you will start your placement, because you are considered healthcare workers, you are typically required to do some TB testing, influenza shots, or maybe to check your immunities, and of course, other routine vaccinations, right? Just to make sure that you are safe to go to the healthcare setting, and of course, to make sure that you are also not a carrier of anything, right? Because there might be a tendency that you will pass it on or you will get them, right? So if because if you don't have those vaccinations, so it's always good that you will have those tests first or your medical check before you start your placement. So, how do we fight pathogens or the microorganisms? Again, we have what we call the clean technique. Sorry about for that. Clean technique, it reduces the pathogens. We have also what we call the sterile technique or eliminates all microbes. So, when we talk about going back first to the clean technique, it's actually like just basic cleaning, maybe like just wiping the table or anything like that with alcohol, something, so that actually uh clean technique, right? While sterile technique eliminates all microbe, maybe a stronger cleaner that can actually clean and eliminates the microbes. Asepsis, it actually breaks the chain of infection. So that means it is more serious cleaning, because we don't want to do the spread of that infection to others, right? So those are some of the techniques. Again, when we say it's actually being achieved through specific practices that prevent contamination. We have what we call the medical asepsis, um, which aims to reduce the number of pathogens with practices like cleaning or disinfection, and also surgical asepsis, which is more strict, sterile technique to eliminate all microorganisms in sterile environments, like the most commonly one in the operating room or OR, right? So the goal of the both medical and surgical technique, they are actually preventing the infection by maintaining the environment safe and free of contaminants as possible. Okay, so that is the main goal of the asepsis. All right. So when we talk about clean technique again, it's weightlifting movement or just a practice of sanitation, right? So it's just a sanitation. Same thing with the sterile technique. Okay. Also, the most commonly one and still the main or the foundation of avoiding the spread or the spread of microorganism is always hand hygiene, right? So it's based on study that it is still the most effective way to prevent the infection. And of course, gloves to protect but do not replace proper hand washing. So again, the gloves, it says it's still safe. Then when you're touching an infectious client to the other, it's still safe of you like protecting yourself. Sorry, even the spread of it, but hand washing it's still the best and the most effective one, right? So it's always, even you're wearing gloves, make sure that before and after wearing gloves, you always do the hand hygiene, hand washing if it's possible, or using alcohol that at least 70%, right? So those are the importance of hand hygiene to avoid the spread of microorganism. Sorry. So supplies and equipment. So again, we have cleaning. Again, as what we have said with during the cleaning, it removes the debris of any dirt, bacteria that might cause into an infection. When we say that as disinfection, this is the one that destroys the pathogen except the pores. So it can actually clean and destroys the pathogen like the bacteria, but the spores are still present. So when we talk about sterilization, this destroys all microbes. So ideally, if you are working in a hospital setting and if you like reusing some things that for the client, then sterilization is always the best technique possible. So we have what we call isolation precaution as well. So in the healthcare setting, especially let's say in a long-term care facility, if your client has symptoms of coughing, diarrhea, or anything like that, we actually isolate them in their room, right? Until a result comes out. Let's say they need to do some lab tests, anything like that, so they need to be isolated. So we have standard practices that applies to all the clients if they need to be isolated, that based on the company policy that you have or that you will be working with. And we also have the transmission based practices. Of course, it addresses the airborne precaution, droplet precaution, contact risk or direct contact risk precaution. And of course, the use of proper PPE is very essential when your client is on isolation, right? PPE is very important. When we say PPE, wearing of gown, gloves, masks, or face shield, etc. Depends on the client's condition. Okay, so it's always important that you know your isolation precaution policy in the company that you will be working with. Surgical asepsis. So I have said that we have two kinds of asepsis, the medical and the surgical asepsis. When we talk about surgical, it's more sterile technique and making sure that it's a microbe free fields, because we usually do it in the operating rooms, right? Because we do invasive procedures there. And it's like big open wounds, anything like that. We need to cut the client's skin, etc. So surgical asepsis is always recommended in surgical units or operating rooms. All right. So if you want to read further with regards to the infection control, you can always check your ebooks. Again, it's Elsevier 2022, Chapter 19, Preventing Infection. Okay. Or also known as infection control. All right. So that's it for today. And we will have Chapter 20 soon. Okay. Take care for now.